So, hello everyone, and welcome to Healthcare's Careers in Focus. This week we are focusing on paramedic careers. We're joined by Ben and Joe, who are going to be talking about roles within the East of England Ambulance Service and being a paramedic within a GP practice. So, yeah, I'll hand over to Ben so you can introduce yourself. And I know you've got a video that you'd like to share.
I'm really proud to be the Chief Executive here at East of 4,000 staff and 1,500 volunteers across a large region. We provide services to our patients 24/7, 365 days of the year. We couldn't do it without each other.
We are paramedics. We provide safe
and high quality services across 6 counties in the East of England.
With a population of more than 6 million people,
we put patients and the communities at the heart of everything we do.
We're Heart. We deal with specialists in high-risk situations.
We are volunteers, whether it's our medically trained community first responders, our volunteer car drivers, or teaching the public basic first aid skills. We work alongside staff to ensure every patient gets the right care at the right time.
We work in collaboration with our blue light partners across the region to improve patient care and experience.
we work in collaboration with the East of England Ambulance Service. This helps us improve the outcomes for people within our communities.
We are fleet and make ready. We maintain the 535 ambulances and rapid response vehicles that you see on the road. We constantly try to improve our fleet to make it more environmentally sustainable.
We are Patient Transport Services. We provide a non-emergency patient transport for people who are unable to travel to and from hospital or other similar facilities on their own.
We are call handlers. We have 3 control rooms in Bedford, Norwich and Chelmsford, and we take more than 1 million calls a year. In 2019, we took 1.2 million calls.
We are Callies, an outsourced contact centre working with NHS and commercial partners. All profitable income is reinvested back into East and its frontline services.
We train early career staff such as clinicians and paramedics for the future, as well as our current staff within East.
are ensuring our staff feel valued and supported. We work with our trade union partners to improve the wellbeing support provided to our staff.
Together, we are East.
Good afternoon, everybody. I hope you found the video interesting. So my name's Ben, so I'm a recruitment specialist for East, which means I recruit people to work in a variety of roles which were shown in that video there. So to give you a little bit more of an idea of how you can join East and how you can work your way up through some of those roles that you've seen, I'm just going to quickly mention kind of what the process is. So basically, we have a website which is www.eastamb.nhs.uk, and on our website we advertise all those jobs that you saw in that video. Some of those roles are what we would class as perhaps entry-level roles, which means you can apply for the roles perhaps with without having specific training for that role per se. You could apply with just GCSEs, for instance, or with relevant work experience in a similar field. And some of those entry-level roles are covered in that video. So, for instance, the make-ready operatives, that team prepare ambulances. So they stock up the vehicles, they do all the vehicle checks, they clean the vehicles down and get them ready to go. You also saw call handlers. So call handlers answer 999 calls and they pass on all the relevant details to another role called a dispatcher, who speaks to the ambulance crews. You also saw in that video ambulance care assistants who work for patient transport services. So they attend patients that are not emergencies. So they still drive ambulances, they still attend patients, but those are for non-emergency situations. So they don't drive with the blue lights on. The other entry-level role is an emergency care assistant who does drive with the blue lights on, and they're crewed up with a clinician on an ambulance. So there's some of your ways to get started with the ambulance service. They're the roles that you can apply to without having trained for several years to do those roles. And they can provide the backdrop for them working your way up into other roles, such as paramedic, for instance. So there's a direct pathway where you can work your way up from being an assistant on an ambulance to another role called an emergency medical technician, which is a clinical role. And from there, you can then do another apprenticeship to become a paramedic. So that's one of the routes that you can take if you wanted to work as a paramedic on an ambulance, just as you've seen in that video. Or alternatively, you can study at university a course in paramedic science, and they're the two different routes that you can take. But hopefully the video is giving you an idea of a number of different roles that are open to you if you're interested in joining East.
Thanks, Ben. And yeah, it was really helpful to see all the different roles highlighted in the video and how they all link together as well. And thank you for going through kind of those roles and those entry types of roles and then where that leads on to as well. I know that Joe is also here, who's a paramedic, so I'm going to pass over to Joe and I will just share your slides.
Thank you, Amy, and hi everyone. So my name's Jo Hercules and I work as an advanced clinical practitioner in general practice in the Peterborough area. I'm professionally registered as a paramedic, as Amy said, and I've worked in the NHS for about 25 years now. This photo was taken in 2004 and it shows the critical care doctor and paramedic team that I worked with MAGPAS, who is an aeromedical service. You'll see from the photo that if you can spot me, that I'm only one of 4 females in this team. I was the only female paramedic, the other 3 females are doctors. So this does highlight, about 20 years ago as it is now, the male dominance of the pre-hospital and paramedic workforce of that time. I'm pleased to say now that approximately 43% of the UK ambulance workforce is now female. Next slide, please. So whilst this slide is really all about me, sorry about that, it's my career journey. I use it more as a means to demonstrate the many possibilities when considering a career as a paramedic, including making it as a second or third career option. So where did my journey begin? Well, in year 11, which was year 5 back then, there were 2 people in my class that went on a pathway to university. The rest of us were really looking for work or looking for work-based education or an apprenticeship. My interest at that time was photography, which really stemmed from my grandfather having a dark room and teaching me how to develop and print photographs. So I didn't really know what I wanted to do at 16. I attended what was then the Huntingdonshire College to study A-level photography, and I worked for a graduation and wedding photography company. And when I turned 18, my boyfriend suggested we head to Australia for a year on a work visa. This was not a time when I owned a mobile phone, and although the internet existed, I didn't have access to it. So I think I nearly gave my poor mother a heart attack being so far away from home with very little contact opportunity. Sorry, Mum. We had a system of once weekly phone calls via landline and the same scheduled time each week, and a letter in the mail, which would arrive 2 weeks later. And I found some work in retail to pay my way through the year, really. Still had no real career ambition. So I came back to the UK after the visa ended, and I was fortunate to achieve my old job back with the photography company, and I worked my way up to become a customer service manager. So all of that taught me with the travel and the service industry was that I really enjoyed working with people, but I didn't quite know how to use that. And when the digital market really started to take hold of photography, which is more of an IT skill, which is not my forte, I pondered really what I should do next. I knew I liked travel, I knew I liked adventure. I'd learned to become a scuba diver and worked my way up to be a scuba instructor. And that was really going to be my next career move. I also considered becoming an air hostess, which if anyone has seen Pan Am, the drama series that's on the TV at the moment, I can vouch that my experience of the uniform, hair and weight checks when interviewing for Virgin Airlines at that time is very similar to the programme. I didn't move on to the next round of interviews. And I then saw an advert in a local newspaper. Yes, we had newspapers for trainee paramedics. And I hadn't really given it much thought, as I don't have a strong science background or academic background. Most of my experience was within art and languages. But I did have 5 GCSEs at grade C or above, including English and maths, and experience, of course, of working with people, including angry people in my customer service role. So I applied, I interviewed, and I was accepted for the role. It was a long recruitment process, which included a physical fitness test. But once I was accepted, I was enrolled onto a residential program, which was a 6-week clinical program and 3 weeks of emergency driving, as it was there, which would be really more reflective of the entry routes that Ben was sharing earlier. I did many practical exams, including OSCEs, as we call them, which incorporated the use of resusciani to perfect skills such as resuscitation management. And to this day, the smell of the clinical hygiene wipe on the rubber of the mannequin still makes me feel nauseous because it awakens all the nerves and butterflies of walking into an exam room, ready to put to test all of those new skills that you've obtained. My training centre was Mersey Regional, and I remember doing our emergency driving training around North Wales, and we stopped into an ambulance station. And when we sat in the crew room there, it was actually the time that the second plane hit the towers in the 9/11 event, unfortunately, and it was a stark realisation of what me and my fellow trainees had signed up for. So it was a very quiet and reflective day for us all, but it didn't put any of us off. So we carried on with our training journey. And I successfully completed that entry-level route and moved forward with my paramedic training, which was another 6-week residential training in order to be eligible to apply to be registered on the Health and Care Professions Council site, which now as a minimum requirement does require an undergraduate degree pathway, either via direct entry through university or via the apprenticeship route. Paramedics can perform many skills, as you saw in the video, such as intubation, cannulation, administer certain medicines to patients, and typically are the most senior clinician when responding to an emergency. So the ability to work autonomously is a must. Soon after qualifying, back to the photograph was the critical care team with MAGPAS. I worked there for a couple of years. The team there is a helicopter service that provides roadside anaesthesia. At that time, it's a charitable service, so I was working voluntary, so unpaid hours for both training, skill retention, and for the work shifts themselves. And we did lots of risk assessment there. Helicopters, unfortunately, have a habit of falling out of the sky, statistically. But one of the interesting take-home messages at the time from aviation data was the least amount of risk that you can find in a fight or flight situation is to have both one male and one female making decisions. So that was an interesting outcome that we try to adhere to in our critical care teams. During my time with the ambulance service, I was promoted to a clinical manager, which meant overseeing the day-to-day running of 2 small ambulance stations and their staff, and whilst also remaining operational as a single responder. So responding alone to emergencies meant that you were in a car basically versus a 2-man ambulance crew. Then I had a 6-month period of maternity leave, and on my return, I applied to change my speciality to primary and urgent care and took a postgraduate certificate to work as an emergency care practitioner. This meant that I was still employed by the ambulance service, but was stationed in a GP surgery, so seeing patients in clinic and responding to 999 work. I then found opportunity to work as a senior lecturer with the University of Hertfordshire on the undergraduate and postgraduate paramedic science programmes. I worked as the first-year programme tutor, and I was the first point of contact for approximately 90 paramedic trainees in the first year of study. Their placements occurred early in their programme, as they do, and that was with the London Ambulance Service. And I felt privileged really to be able to help and support these young adults navigate the challenges that initial exposure to the emergency environment can bring. You don't know what you don't know. You don't know how to prepare for a crisis until you're in one, essentially, is emergency working. So it's nice to be able to have some support mechanisms around you. As much as I love being in the classroom, I found it fun and rewarding. I did miss being clinical, and after 2 years, I returned to general practice, where I decided to complete my master's in advanced clinical practice, which included qualification to become an independent prescriber. Continue now to work in general practice, but I also work 1 day a week as an allied health professions ambassador for our local training hub, which is a service that provides educational and training opportunities and professional support for the general practice workforce. Next slide, please. So thanks again, Ben, for the video, which highlighted really some of the work that the paramedic does and the different routes into the ambulance service, both clinical and non-clinical. It's fair to say, really, I suppose, that paramedics working for 999 ambulance services are fairly well publicised. So I think if you're interested in the role, you've probably had some insight already from TV and media. What I can say is that being a paramedic will suit you if you're happy dealing with uncertainty. So the greatest pleasure for me working as an ambulance paramedic was that at the start of each shift, your slate is clean. There is no pre-planned workload, no to-do list, no carryover of work from the next day, from one day to the next. You simply turn up and go wherever the day takes you. And then when you clock off, that's you done. So that's a really great feeling. Not many jobs have that. The greatest challenge for me was not only being awake, but also working in extreme conditions in the hour between 3 and 4 a.m. I never drank caffeine until I started night shifts. That hour between 3 and 4 feels like when the rest of the world truly is asleep, and it's the quietest time of the 24-hour period, I feel. And it's difficult to adjust your brain to be able to be highly functioning at that time of day. To give an example of this, I do remember I was called to a road traffic collision incident on the A47 at Thorney Toll, which is a 60-mile-an-hour carriageway, a straight road, but it's a country road. It was about 4 o'clock in the morning. We were called, me and my crewmate, on a 2-man ambulance to a minibus that had crashed into a brick building. There were about 20 occupants in the minibus. There were no seatbelts in the rear seats. Me and my crewmate were the first on scene, and we were advised that there was no ambulance resource available in the area to back us up. So we were going to be alone clinically. Police and fire services had been notified, but again, due to the remote location, there'd be a delay in their arrival. When we arrived, both carriageways were open to moving traffic, which is a 60-mile-an-hour road, as I said. And it was pitch black. There was no street lighting. The front of the minibus was embedded into the brick wall. Some people were in the minibus, some were wandering around, some were in a daze, some were wandering into the road. Nobody spoke English, but the driver was able to communicate a few words. So typically in a situation like this, the first thing to do from a safety perspective would be to secure the road and to close it. The best we could do was to park our ambulance in a position that was visible with the emergency lights on, in hope that the passing traffic would either stop or divert. There was a pub opposite the crash site and the landlord lived in the apartment above. Ideally, everyone would have been kept immobile in their positions in the crash site until we could rule out any major injury, including spinal injury. But as they were all wandering around, this was not possible. There was greater risk actually of them having further trauma by being in the road. Therefore, we asked the landlord of the pub to open up and provide a safe, dry and warm space for us to be able to assess people. We declared this as a major incident, which is when an emergency situation poses serious threat to either the health of a community or causes high number of casualties requiring special arrangements to be implemented. In this case, it was because we didn't know the severity of injury and we were completely overwhelmed in terms of resource. We asked the driver to tell everyone who had remained in their seat to stay in their seat in the minibus. I remained with the minibus whilst my colleague escorted those that were wandering in the road over to the pub, where they were asked to sit and not move around until we could get back to them. My colleague contacted Language Line, which is an online interpreter service, and I worked with the driver to assess and clear people from the minibus, moving them to the pub when safe and able to do so. We then methodically ran through emergency assessments for each individual with the help of Language Line, and thankfully there were no major injuries, and after the first 15 to 20 minutes, other resources began to appear on scene to assist. So this is not textbook, this is not what you learn in the classroom. The challenge of paramedic practice is being equipped with knowledge and training, but then being able to apply it in an unusual circumstance with limited resource. There were 2 hours remaining in that 12-hour night shift when this incident occurred. So your body is starting to wind down, it's ready for bed and sleep. Then you're hit with this large dose of adrenaline to meet and rise the next challenge which presents itself. Bed has to wait. Next slide, please. By contrast, working in general practice provides a much more static environment, as you can imagine, with regular hours and a team feel to everyday practice. There's lighting, there's heat, there's warmth, it's dry. And although working in a room on your own, there are always other members of the multidisciplinary team. There's always more senior members around to seek help from support from. Whilst both emergency and primary care work requires the ability to spot red flags, which are signs and symptoms of illness or injury that require rapid intervention to prevent worse outcomes, typically in primary care, the start point is to assess the need for escalation, and in emergency care, it's to look for the ability to de-escalate. So it's a slightly different mindset when first meeting patients. We tend to use the words patient assessment for emergency care and patient consultation for primary care, which sort of gives a flavour of the speed and nature of the interaction. Paramedics have been able to apply for and train to become independent prescribers since the law changed in 2018, and obtaining this licence has given me the ability to work autonomously at the top of my clinical pillar and scope of practice. This module does sit within the Masters in Advanced Clinical Practice programme, and to apply you have to be 5 years post-registration and have worked in the area you intend to practice in for a minimum of 2 years. I've just got a short video to explain a little bit more about what this role looks like. If we could play the video, please.
Meet our advanced practitioner, one of our healthcare professionals. When you contact us, we may arrange for you to see them. Based on your needs, an appointment with the advanced practitioner might be face-to-face, by video, or by phone. An advanced practitioner is a specialist skilled in assessing, diagnosing, implementing, and evaluating treatment or interventions and care for patients presenting with an undiagnosed condition. Your advanced practitioner may be a specialist clinical pharmacist, physiotherapist, dietitian, podiatrist, occupational therapist, paramedic, or nurse. Our advanced practitioner can clinically examine and assess patient needs from a physical and psychological health perspective and plan clinical care accordingly. They may order investigations or prescribe and review medication appropriate to patient needs and support patients with adherence to prescribed treatments. Advanced practitioners can prioritize health problems and intervene appropriately to manage your care in complex, urgent, or emergency situations, including initiation of effective emergency care or appropriate onward referral to other services. Typical appointment times with an advanced practitioner will vary dependent on their speciality and your individual needs. Our advanced practitioner is one of our healthcare professionals. Working together with your GP, their unique skills, knowledge and experience, let us give you the right care at the right time from the right person. All within your local community.
Perfect, thank you. So what are the rewards and challenges of being a paramedic? It's really important not to forget how privileged it is to be able to enter someone's life in their worst moments, and how mindful we should be to respect, protect, and hopefully improve the outcomes to the challenges that they face. That to me is the greatest reward, to have that privilege. I'll give another example. So if you find an older person on the floor after a fall in an ambulance paramedic capacity who's been there for over 12 hours before they could call for any help, they may have injured a bone or sustained a head injury. They may be very cold from being on the floor, and obviously incontinent because they've been unable to get to the toilet. Once the person's deemed to be stable, you might want to ask yourself, are you someone that would focus on the injury, blanket around them and move them safely to a busy A&E department for further care and assessment? Or would you take a step back and put yourself in their shoes and go the extra mile and maybe consider their holistic care needs, such as helping to clean and change them if it's practical to do so by changing their clothing, to be able to maintain their dignity and comfort before their transfer? Being a paramedic is not all about blue lights and life-saving intervention. Every intervention does matter. Knowing that you're working for more than just money is also a really big reward. So the NHS will not be the most competitive in terms of the private sector. The private sector, of course, may have greater financial reward. But if really money is the only motivator, you'd have to question, is this the right job for you? Although the NHS is much more competitive now, there is other work that you can do for more money. Being part of a globally respected team is something I'm very proud of. Public services will always come under scrutiny. There's always two sides to every debate, and we do live in an imperfect world. We do the best that we can with the public health system that we have, and I think that we do better than many countries overseas. And I'm grateful to be part of its continued provision. The downside of living in an imperfect world is that we are hit in the face on the regular with complaints about the system, and it can feel like it's never ending and there's never enough time or resource to do enough for everyone. Emergency workers have likened frontline services to going to war every day, with decisions being made to do the most for the most, leading to compromised care at times. Working with what little you have and doing the best of what you can to your best of your ability can be exhausting. So it's really important to take adequate rest and take breaks, and to protect against burnout. For me personally, the most challenging stage of my career was navigating the early phases of the pandemic and always feeling on the back foot. So people looking to you for information and knowledge that we didn't have, and trying to lead others and reassure others without that certainty. Another challenge is trying to navigate your own personal life alongside a professional role in healthcare, because none of us, of course, are immune from the experience of ill health, injury or death. I do have friends that don't work in healthcare, and when faced with personal stress, they find solace in their work as it's a rest period essentially from the emotion at home. But when your work is literally handling life or death matters for other people, and you're doing this in your personal life alongside that, it's not easy, and it does require discipline and resource to protect yourself. The greatest challenge for me at times has been trying to maintain a work-life balance, because I've loved all the roles that I've done, and the people that I work with are a really good community, so you feel like you can really immerse yourself in it. And I've had to be really deliberate about remembering to take time away from that and to take time out. Next slide, please. So if I was to look back, and what would I have done differently? Nothing. What would I advise myself? Probably the things that I have along the way. I think probably one of the hardest things that I had to deal with was when I was in the critical care team. I applied for the diploma in immediate medical care with the Royal College of Physicians, which was a highly acclaimed certificate, which not many people had as paramedics. I had some brilliant mentors that worked with me in unpaid time, sitting with me, talking me through exams. It's a very unique exam assessment. And the first time I went for it, I'd put in about 6 months of effort, solid effort, and I felt I was well equipped to undertake the full day of assessments, and I failed, and it was a very hard journey, because I knew how much other people had invested in me and how much I'd invested in myself. But my mentor picked me straight up afterwards and said, we're back to our next session. You're coming on Sunday, I think it was, the following week. And we started again. And the earliest application was 3 months after the first rejection. So I put myself forward again and I went back at it. So the message of if it hasn't worked out in the end, it's not the end, and keep going, basically. Many people can turn away from failure, but I did learn a lot from the process, and I did come out better at the other side of that. The other really strong message for me is that we can't expect to have a good day every day in whatever we're doing, professional or personal life. But if you can find just one thing that does make you feel good about yourself or about other people in your day, that will keep you going regardless of what you're facing. And also not to become complacent. So if you've climbed a mountain, like me doing my diploma in immediate medical care, don't stop there. Look for your next challenge. It keeps us humble to move from the trainer back to the trainee, trainer back to trainee. It keeps us positive, it keeps us motivated, and keeps us mindful. Next slide, please. So is this for you? Well, I'll take this back really to the minibus example and look at some of the personal attributes you should have to become a paramedic. I mean, good communication skills aren't as straightforward as just saying, how well can you engage with another person, either face-to-face or by phone? It's using all of your strengths to monopolize on a situation such as the one we faced, where there was no English speakers, there was chaos at a road accident scene, and trying to lead others to do what we wanted them to do to keep them safe, whilst also being able to show empathy. So how would you feel in their position? It's a very distressing scenario. You don't know what the level of injury is. People are scared, they're frightened, and they're looking to you to be calm under pressure. And having attention to detail. So, you know, we could put all our focus on the person that's loudest, noisiest, looks most unwell, but we also have to be very careful about those that are quiet, sitting, doing nothing, speaking to nobody. They may also be very critically ill. Adaptable, as I said, you don't get things from textbook when you're working in a paramedic world. You can only equip yourself with skills and knowledge to be able to overcome situations at best at certain times, and you have to be able to solve problems and make decisions quickly. You do work in a team, you do work on your own at times, but working in a team, it's important that you are sharing out responsibilities so that you're maximizing the resource that you have, but also the ability to lead others. So we obviously had to do that with both the people on scene and also the other emergency services that we encountered, such as the fire service and the police service. And having a degree of emotional intelligence, it's a bit of a cliche term, I suppose, but you have to have some insight into human factors to be able to be a paramedic. So if you haven't had much encounters with the general population in terms of either life experience or school experience, in terms of engaging with others and speaking at a level that's beyond the surface level, that's something to really explore before deciding whether paramedic is for you, because you really have to tap into that to manage people's emotions in their critical scenarios. Next slide, please. So we'll just run through a few questions just to get a flavour for what it is in terms of making decisions as a paramedic. So in this example, that you are the paramedic attending a 999, it's a high stress situation and you're needing to make decisions quickly to impact the patient. You're responding to an accident scene. The patient is conscious but very anxious and in a lot of pain. So would you A, reassure the patient and tell them that help is on the way, B, calmly introduce yourself and tell them what you're going to do, or C, do a thorough examination of the patient? So we'll just talk through each option in turn. Pause for a moment while you think whether that A, B or C is the right answer for you. But with A, obviously we're having to change our mode of thinking. So we are the help now. So although, yes, reassuring the patient is the right answer, we are the help, and we should be letting the patient know that we are the help. We may need further help, but that's appropriate too. So it's not a wrong answer. It's just trying to put yourself in those shoes of being the most responsible at that time. B, yes, we should be calm in our approach when introducing ourselves to patients, and we should let them know in advance of what we're going to do. So it's very important to get consent from patients that have capacity. So capacity means that they have ability to say yes or no to the things that you want to do in order to keep them safe and to make a thorough assessment. C, do a thorough examination of the patient, yes, is also appropriate, but it is a stepwise approach, essentially, is the answer there. So you're looking to make sure that you do have an assertive but calm approach to a situation, reassuring the patient, involving them in your actions, seeking consent where you can, and yes, doing a thorough examination. Next slide, please. So the next stage, the patient appears to be comforted by what you've done. So what do you do next? Do you A, complete a detailed exam of the patient while continuing to calm and reassure them? B, ask a bystander to offer support to the patient whilst you treat the injury? Or C, instruct the patient to stay calm whilst you treat the injury? So A, yes, we've said we do need to complete a detailed exam, and we do need to continually reassure and calm. It's not a one-time situation. But if you're there on your own, you may wish to involve others to help with some of that, because it depends on the level of the injury. So asking a bystander, if appropriate, and if they want to, may be something that you want to utilise in order to keep a dialogue going whilst you're focusing on a high intensity intervention. If it's less serious, you may have the ability to focus on more than one task at one time. So it just depends on the situation itself. Instructing the patient to stay calm depends on the tone. So, of course, we want to encourage the person to stay calm by reassuring them, but we don't want to instruct them. So I think the flavour there really is just about how you engage with the patient. Next slide, please. So you need to transport the patient to hospital, but there's a lot of traffic congestion on the route. So how do you handle that situation? Do you A, use lights and sirens to drive through the traffic? B, ask the control room to help you with an alternative route? Or C, do you remain calm and monitor the patient closely whilst driving through the traffic? So the use of lights and sirens is only for time critical situations. So again, it depends on the level of injury or incident. If there is risk to life, then with a patient on board, then yes, lights and sirens can be used, but not simply to manoeuvre through traffic. So that is a wrong answer in the sense of minor injury. It may be the right answer if there's a time critical situation. B, yes, asking the control room in some circumstances may be an option, but most ambulances now are set up with a sat nav, which would be pre-programmed whilst you're driving. So it would be very difficult to navigate with somebody on the phone whilst trying to change direction, unless you have really good local knowledge of an area, in which case you may know a bypass. Ben might know better than me, but I'm not aware of sat nav override from an external source such as a control room. That may be in place now. It's been a few years since I've been with the ambulance service, but it does show that you're considering all resources and adopting to the situation. But C, the important thing is that you remain calm, because traffic is inevitable. The clinical environment is a mobile one, so we're always having to move from A to B. And if there's a patient on board, they will be stressed and anxious depending on what's going on with them. Provided they're clinically stable, it's your job to keep them calm and safe whilst they're on making their journey from A to B. Next slide, please. The patient's condition is stable, so we've had that answered for us. But they're concerned about how long it's going to take them to get to the hospital. So how do you respond to that? A, reassure them and advise you're getting them there as quickly as you can. B, provide them with updates on the expected time of arrival. or C, focus on monitoring their condition whilst reassessing the traffic? So again, yes, reassuring the patient is priority. Advising them you're getting them there as quick as possible doesn't give a context to the patient. So if there is high level anxiety and we don't know about the mental health presentation behind the incident or injury itself, sometimes knowing in advance how much time is left, a bit like being a rear passenger in a car that on a long journey and wanting to check the sat nav as how much longer before we get there. So just giving some information can help more so than just saying it's as quick as we can. B, providing updates with expected time of arrival, as just alluded to there, really. But C, yes, you do need to focus on their condition, but whilst addressing the patient's anxiety. Next slide, please. On arrival at the hospital, there are delays getting the patients booked into the department. Unfortunately, this is quite a common occurrence in today's world. So do you A, alert the hospital staff and stress the urgency of dealing with your patient? Or do you B, stay with the patient and monitor their condition until they can be safely transferred? Or do you C, request immediate assistance from the hospital security or admin team to monitor the patient so that you can move on to the next 999 call? So A is important, of course, again, if you've got a time critical situation. What you don't have is overview of other patients in the building. You only have oversight of your own. So letting hospital staff know what the problem is that you're dealing with means that someone who is more informed can make a prioritisation decision as to whether your patient needs to be seen sooner than the queue. B, staying with the patient, of course, to monitor their condition. The patient will remain in your care until safely transferred to another responsible member of the team, clinically able responsible member of the team. C, requesting immediate assistance from the hospital security or admin team to monitor the patient is not appropriate. So again, handover has to be to a clinically competent member of the team that you can safely hand over and transfer the patient's care over to. Next slide, please. So thank you all for listening. So it was a bit of a quick run through. Hope it's given an insight really into the options for being a paramedic. So from entry level and all of the other roles pre-paramedic with the ambulance service and non-clinical that Ben alluded to, and then becoming a paramedic, a registered paramedic, what the options are post-graduation essentially. So as an advanced practitioner, there is options for both education, management, senior leadership, research. The environment obviously can vary. And this is from our professional body, the College of Paramedics, with the advert to really promote that not all paramedics wear green, just so that you're aware and recognise that becoming a paramedic doesn't mean that you are static with the ambulance service wearing a green uniform for the rest of your career. There are many career options both within the ambulance service and in other arenas. Thank you for listening.
Thank you, Jo. That was really insightful. I've learned a lot from hearing what you've shared throughout your career journey and kind of those case studies and insights, and kind of having that detail around actually in those scenarios what you can do to help your patients. I guess as you were a paramedic and you've transitioned into an ACP role, how did you kind of adjust to that change? Because kind of from what you said, it was quite you were kind of undertaking it and kind of would leave the role and then come back and kind of finish it. But with this kind of the ACP role, you're kind of more in that everyday kind of setting.
Yeah, so even today, so I've been in general practice now for about 10 years. I still find it challenging to be static. So I'm a physical hands-on kind of person, and physical examination in general practice is probably the least activity that we do. There's lots of brain power being used, there's lots of organisation skills, there's lots of referral, there's lots of communication. Whereas being a frontline paramedic, it's a very practical job. It's moving and handling, it's moving all of the time, looking out of the window and not knowing where your next destination will be. To me, I really do miss that. I would even say I miss shift working a little bit, but now along those years I had become a mother. He's now left and he's at university himself, but I would say probably having static hours in general practice 10 years ago was helpful as a parent. I wouldn't need it quite so much now. I do miss just turning up, like I said, sort of alluded to earlier, and not really knowing what the day will bring. That's quite exciting as a job. There is some mundane elements because obviously there is repetition and there is similar workload, but it really is no 2 days are the same. And sometimes you question your judgment. You might get called to the same thing 3 times in a row. Your next 3 999 calls might all be the same thing, and you think, am I making this up now? Because that's just how it goes. And then the challenge in primary care is managing caseload. So I've never been more challenged than I am now as an advanced practitioner in general practice, because you are not only dealing with the day-to-day workload, but you are holding that information because of continuity of care. So you are continuing that journey with the patient. You're not handing it over essentially. General practice is a point of contact. It's a kind of like a pull together of wherever the patient's journey's been, whether it's been through secondary care, emergency care, urgent care. All of that information comes back to general practice, and we hold that information to then support the patient on the next steps of their journey, and we review and we follow up. So when it's a difficult situation, so managing patients at end of life, managing patients with irreversible disease, with rapid progression, you're having to walk that journey with them. So you do hold that, and that's just the human factor of a care role, is that trying to find that switch off. Whereas with emergency care, I would say there's less of that, but actually the challenge with emergency care is not always knowing what happened to the patient next. So you don't know the next steps, and you might want to know. So there's pros and cons across both. I think probably for my stage of life and stage of career, I'm more comfortable as an advanced practitioner in a static environment than I would be to roadside at 4 a.m. But I certainly enjoyed that for a good 10 years.
Yeah. Great. And it's great to see actually you can where your options are actually if you are a paramedic, where it can lead you to as well. And actually, like you say, you might want to have a bit more static hours, so then there's those different options as well. Great.
Absolutely. Yeah.
Thank you. I don't think there are any other questions. So I'll just so thank you, Jo, and thank you, Ben, for sharing today. It's been really insightful and I've learned a lot. So I hope everyone else that's watching this also takes away from that as well. And thank you for taking time out of your busy days to share this with everyone. So there's just some feedback. So if you don't mind scanning the QR code just to feedback on how you found today's session, and let us know what you think. And we welcome any suggestions or ideas for future sessions too. But yes, thank you all for joining us, and we look forward to seeing you again in the future. Thank you.